Population aging is happening in many countries around the world, including Vietnam. According to the statistics of the General Department of Population and Family Planning under the Ministry of Health, Vietnam officially entered the aging process in 2011 when the elderly 60 and over accounted for 10% of the population. Since then, the speed of aging has been increasing rapidly. It is projected that by 2038, the proportion of elderly people will increase to 20%, double that in 2011, making Vietnam one of the 10 fastest aging countries in the world. Aging population brings many challenges to many industries, including healthcare system. This topic has been discussed in many forums in Vietnam. Health experts also asserted that the aging population will put pressure on the health system in terms of facility, special care systems, as well as large amounts of medication. Greetings from Vietnam on VTC10 Viet. As a low middle-income country and with the fast speed of aging population, Vietnam is facing many challenges in the healthcare system, especially for the elderly people. To understand more about this issue, in today's show, let's have a talk with Mr. Garcia from Vngn Institute from Singapore, who has done a research on this topic in Asia. So thank you for joining us. The first question is, this is the third time that you're here in Vietnam. So what can you say about the development of Vietnam and especially about the healthcare system here?
Well, it's good to be back. It's good to be back in Vietnam. This is my third time in Hanoi. My first time into Hanoi was about 6 years ago now, in 2012. I actually came twice that year. But it's very, very good to be back in Hanoi. And in terms of the development, everyone knows that Vietnam really is a high-growth economy, an economy that's growing very quickly. But at the same time, it has some challenges related to its aging population. And of course, that will have implications on the government's ability to pay for public health care, public pension programs, especially if the country doesn't graduate to higher income levels and economic levels.
So what can you say about the healthcare system for the elderly people here in Vietnam?
So what we find, I think, is there is great commitment by the government here to really provide healthcare programs and pension programs to support the elderly. And that's all very good, because especially as they age, they're going to have to spend more on costs of care, long-term care, things like that. The issue is that many of these elderly populations now kind of grew up in a time where income was still very low and they couldn't save a lot from themselves. And so they will come to depend quite heavily on those programs as they age. Another reason being is family sizes are also shrinking here in Vietnam, like a lot of other places. And so with smaller family sizes, you also see less support overall per aging parent or per aging parents. When you look at today's elderly, yes, there will be that transition where you'll have increasing healthcare costs just because of the nature of economic growth. But for the elderly, they will need a lot more financial support in the form of subsidies or in their pension programs or some other sort of sources of support to pay for those increasing healthcare costs.
The population here in Vietnam is aging rapidly, so what are the challenges for the healthcare system, particularly, do you think?
Data shows that Vietnam is probably one of the world's fastest aging countries, and that's really defined by how big its elderly population, usually it's defined as those 65 and above, how big that group is growing compared to the rest of the population. So how will that affect Vietnam? That really will affect Vietnam in two ways. We have to realize first that Vietnam is still an emerging economy. And for an emerging economy to reach high income levels, usually it requires a combination of labor, capital, productivity. But if its labor starts to age and eventually shrink, that will make growth in the future a lot more difficult. At the same time, a growing elderly population reduces the tax base and really the amount of revenues that government can collect from the working population. So either it will have to raise taxes, which is not very politically viable in some countries, or it'll have to rely on other sources for taxes. But really, in general, what will happen is, in the long term, as the population continues to age, spending on public healthcare, spending on public pensions will increase, and without significant changes either to the tax structure or to economic growth, could really find itself in a tough position to have to spend on those age-related programs, as well as what we consider investment-related spending, infrastructure, education, technology accumulation. And because of that, and because of a range of other issues, it will really place pressure on both the public and private sector to provide affordable, accessible healthcare to an aging population that may not have the financial resources to avail of those services and programs. Healthcare policies, it requires a change.
According to the Ministry of Health, aging population is a huge challenge for the Vietnam healthcare system, including the increase of chronic diseases such as hypertension, stroke, diabetes, cancer, and requires lifelong treatment. Specific syndromes in the elderly age, vulnerability, reduced cognition, Alzheimer's disease, walking disorder, decreased functional activity, confusion, depression. It is noted that the elderly people have no typical symptoms, using multiple medications and malfunction of human internal organs due to increased treatment. According to the Ministry of Health, the cost of medical care for the elderly is 7 to 10 times higher than among young people. However, medical costs for the elderly are not as high as anticipated if there are reasonable approaches, and elderly care services are a potential market for businesses to invest.
Solutions are, of course, looking at prevention. If people are older but living healthier, I guess that means they're going to firstly be happier and secondly incur lower cost. So the prevention and public health agenda has to be number one. But then, of course, as we move forward into the healthcare access, we have to be looking at strengthening primary care. We have to be looking at how do we devolve and push out medical care into the home. And I guess from an Asian perspective, that is what a lot of people in the UK are now trying to do. We're looking at our current care models, lots of hospitals, lots of inpatient focus, and really how do we push that out to the community. Now I think in Asia there's a great opportunity to not engineer the hospital-based systems, but really focus on the home care, the digital, the sort of community level support alongside prevention to really sort of leapfrog some of the challenges in developed markets and move forward.
According to experts, Vietnam needs a long-term strategy to contribute to slowing down the aging process, maintaining a reasonable birth rate, at the same time to promote communication on population aging and care for the elderly. The government should also encourage private investment in the development of health services related to the elderly, provide enough infrastructure as well as skilled human resources. As the population is aging, the number of non-communicable diseases is also increasing. So how should the healthcare system deal with this problem?
So if you look at non-communicable disease, the reason why it's a concern is because it's unlike communicable diseases where you kind of contract an illness and either get very, very sick and pass away. Non-communicable diseases are very long-term in nature, right? You're talking about chronic obesity, diabetes, cardiovascular concerns. And so the long-term nature of that requires a lot, in the long run, a lot more spending to care for that patient. So from the public perspective, right, if you have increasing life expectancy, but also increasing non-communicable disease, what you'll see is, older adults who will require more money over a longer period of term to finance care costs. And if that's the case, you might see an aging cohort that really has very poor health outcomes, which really isn't beneficial for the families or for societies. So as a researcher at the Vngn Institute, my key message really was to from the perspective of the Vngn Institute, our key message really is the need to redefine traditional notions of aging. If we want healthcare costs in the future to be more sustainable, especially among rapidly aging emerging economies, I think governments and businesses will really have to think hard about how they allow older adults to interact in society, whether it's in jobs, whether it's in the community, because we feel that, you know, the older adults really have potential in contributing economic value, social value back to their home countries. And there is a lot of value in that. There is a lot of value to be captured when we think about them as assets to society rather than burden. And so if we think about them in that way as assets, and we start restructuring our healthcare policies to support long-term, active, purposeful engagements, then really that's where the value to society and to the economy can come. But really it requires a much more supportive environment for them to do so. It requires an ecosystem of preventative and long-term, active, healthy.
So what is your prediction on the healthcare system for the elderly people in Vietnam in particular and in Asia in general?
For future trend, it's always, of course, difficult to predict the future, but what we expect to see, especially for rapidly aging emerging economies, the trend will be one in which governments will have to restructure their healthcare policies, their pension policies, if they want to make that financing more sustainable in the context of, you know, possibly shrinking labor size and you know, lower economic growth in the future because of that. In terms of healthcare expenditure, yes, models that may have worked in the past for other countries may not work today, just given the fact that things change so rapidly. So curative care, what we call curative care, where it's, you know, policies that respond to illnesses as they come up, might not be as sustainable as instead treating for the long term and trying to prevent it instead over the longer period than the short period. So really what we hope to see and what we at the Vngn Institute hope to see is a shift from more the curative side of healthcare, which can either be sometimes too late, it can be unaffordable, it can be unsustainable in financing, to really looking at health as a long-term thing. So, you know, start early, educate, provide preventative services. So not just the elderly, but when we're our age, we know how to reduce our chances of non-communicable diseases, you know, like diabetes, chronic heart conditions, things like that. So if we look at that long term, that not only is better for us when we age, because, you know, we won't have to be spending to treat non-communicable diseases, but it will also be good for government expenditures who wouldn't have to spend so much on really supporting these expensive, you know, non-communicable disease burdens of an aging population.
Once again, thank you for joining us and for your sharings today.
You're very welcome. Thank you.
And that's all we have for this episode of Shine Vietnam today. For comment and feedback, don't hesitate to write to us at shinevietnam@netvietv.net. Thank you for watching and goodbye for now.